The following video shows aerial view from drone footage of a lakefront cityscape of Chicago with high-rise apartment buildings and several nursing home facilities that house
Hi, my name is Tony. I was at Lakefront for 4 years. I'm 48 years old. I was there for 4 years. Like I said, I had problems from day one. It was really bad. I even got physically abused there.
Early in the morning and, after 5 o'clock, all the masks are falling off. And when I see that, I just go into my room and I don't talk to people without masks, period.
August of 2019, when I moved into Chalet, I'm in a building with many people who don't wash their hands after the bathroom, so no, I did not feel safe from the get-go.
The roommate that I had who went to the hospital had COVID-19. I am demanding a test. They came into my room, took my roommate out, sent him to the hospital, then moved another roommate in, and then moved him out. Made it 3 beds in this room. And again, they had moved in a guy into the very bed that the COVID-19 guy was in at 1:30 in the morning.
Because I think the majority of those rooms are not meant to be 3 beds. They're supposed to be 2 beds. That middle bed has no space. Like, it's literally like you can put your feet out on each side, and that's about all you have. And then you have some space underneath the TV.
When the COVID first hit, they were saying about not making unnecessary trips to the hospital, no face mask, no social distancing. They didn't let people know how many cases was there. It was just real dangerous. They had no separation from people that were sick.
I intend to marry and have children and a life. I don't belong dying in this, what I would term a hellhole, okay?
Considering the facility that Bria is, I want to be as least involved with them as humanly possible.
About 3.1 million Medicare beneficiaries resided in nursing homes in 2020. 42% of them, 1.3 million beneficiaries, had or likely had COVID-19. U.S. Department of Health and Human Services.
And now I am honored to introduce our next speaker, Ebony Payne.
Good afternoon, everyone. My name is Ebony Payne. My pronouns are she, her. Imagine being paralyzed from the neck down, living in a nursing home, depending on someone else for your daily needs and to keep you safe. My name is Ebony Payne. I'm an African-American quadriplegic female and a resident at Bria of Forest Edge Nursing Facility in Chicago, and this is my reality. I've been a quadriplegic for 18 years now, being paralyzed in January of 2003. I was a victim of a violent crime and involved in a car accident at the same time. Since then, I've been in and out of nursing facilities. However, I didn't begin to self-advocate right away. Having to both experience and witness unfair treatment prompted me to begin advocating. After contracting a near-fatal blood infection, I began to self-advocate. A nurse introduced me to the ombudsman, who are an advocate and a go-between for the residents when she saw the facility wasn't listening or taking me seriously. They became a vital tool for me when I'd advocate for other residents or assist them to advocate for themselves. The October before it was announced as a pandemic, my facility, which houses over 200 residents, experienced an outbreak of residents with flu-like symptoms. I personally experienced severe cough for weeks that progressively got worse, including chills, body ache, and an abnormal temperature. It was so bad that I was admitted to the hospital with what they could only describe as an upper respiratory infection. I remained hospitalized for approximately 2 weeks, having to receive over 2 different antibiotics and 2 different breathing treatments every 4 hours. A few weeks after that, my CNA was admitted to the hospital and diagnosed with the same thing. Once it was established that there was, in fact, a virus spreading, steps were taken to lessen the spread in congregate situations. You have to wonder how effective these steps really are, though. We face things like forced isolation, lack of proper PPE gear, and staff who weren't observing the mandate to isolate and social distance. Initially, the severity of the pandemic hadn't hit any of us yet, but after a few weeks, I was really worried. I wondered how sanitary the facility was actually being. Their initial statement when the CNAs asked for face masks was, quote, "This is a mask-free facility." This scared me because I am compromised. It's much easier for me to contract viruses. Then mental health came into play when dealing with prolonged isolation. Prior to the pandemic, I was accustomed to visits from family every other day, if not every day. I was also accustomed to going out with family. This doesn't count the surprise visits and outings with friends. Needless to say, my mental health was affected, so much so to the point I had to start telehealth therapy sessions. My facility was also in the news. The CNAs were protesting and speaking out about not being informed about the virus and the COVID-related deaths in the facility and not having proper PPE gear. My facility was also in the news as being in the top 3 facilities with the highest number of outbreaks. And here I was stuck amongst over 200 other people with no way out and no way to truly isolate or social distance. We experienced 6 COVID-related deaths, 3 staff, and 3 residents. One of the staff members was in my room giving care the Friday before she was found deceased. One of the residents' family didn't even know he was in the hospital. To this date, my facility does not update us on new outbreaks or patients they admit with COVID. We also had staff who weren't taking precautions and flying to what was labeled as hot states such as Georgia, Florida, California, and Nevada. While my facility has been vaccinated, there's no recourse for people like myself who can't vaccinate due to medical issues. My question is, how do people like me protect ourselves? Being in a congregate care facility, I have to interact with people from being in close quarters with my roommate to social workers and administrators, kitchen staff, activity aides, nurses, and CNAs who also have to interact with each other as well as other residents. Now, isn't that the opposite of isolation and social distancing? Why not make a way for people to truly isolate? A way they can interact with one person, giving them care. A way to be safe during the emergencies and life-threatening situations such as these. In an ideal world, those residents like myself who wanted to leave congregate facilities will be able to. It's much easier to control who you interact with by not being in places like these. This way, if you do become infected, you know exactly who caused you to be exposed. I would love to be able to leave the facility and be in a place where I can control my environment. Currently, I'm working with the Colbert Williams program to transition out of the nursing home, but COVID has caused the backup and the ability to keep and keep the process going in a timely manner. Due to COVID and the facilities being closed to visitors, it's become near impossible for them to properly conduct interviews and assessments. I personally had to rely on the facilities assessment, which had to be corrected multiple times. My interviews had to be conducted via Zoom or Google Duo. And a 3 to 4 month process has turned into 2 years. Trying to navigate the relocation process is a task in itself. And for those residents who are unaware of the resources at their disposal, transition out there just transition out there, just stuck. Something should be done to help these residents who can transition to move. Thank you. And now I'm turning it over to Misty.
Thank you, Ebony. It's certainly hard to follow a story and a difficult process like Ebony, but I'm hopefully able to share a success story of where Roads to Freedom has been able to provide emergency relocation services through FEMA Category B funds. So with that, like Ebony said, my name is Misty Dion, and I'm the CEO for Roads to Freedom Center for Independent Living. I go with, I use she, her pronouns, and I am a middle-aged woman, long dark hair, curly, wearing glasses, sitting in my office. And with that, we'll start sharing the screen. And as soon as we have our slides up, all right, next slide. So transition services, like I said, I am the CEO for Roads to Freedom Center for Independent Living, and as many of you are aware, in July of 2014, the Workforce Innovation Opportunity Act was signed into law and transferring the independent living and disability-related programs to the Administration for Community Living. Also included was the fifth core service of transition, which included pre-employment transition and institutional transition. Money follows the person as authorized in the Deficit Reduction Act of 2005 and reauthorized a few times thereafter. Also helps support states' efforts for rebalancing their long-term services and supports so that individuals have a choice where they live and receive services. So this is, of course, despite disaster or, I guess in blue sky days. With that, I want to show a quick video.
People just want to go out. Like, I don't blame them because we've been in lockdown for now 6 weeks.
80% of Region's deaths are in nursing homes. CBS Pittsburgh.
We were contaminated from her, and the nurses passed it all the way down.
Health official moved mother out of nursing home as deaths skyrocketed. New York Post.
On this last wing I was on, there was 2 portable phones for 60 people. You can imagine how that didn't work well.
Nursing homes ask states for immunity. NPR.
I have gone into other people's rooms to talk to them because I need socialization and had no idea I was exposed to this until just today, moments or so before I made this call.
A woman on oxygen.
Hi guys, my name is Desiree L, and I'm just so excited to share my story today of my transition from the nursing facility. The Center of Independence Living transitioned me in September from the nursing facility after being there long term into my new apartment.
Hope.
I had found out that there was a program, I would be able to get amenities.
She made the necessary arrangements to get furniture and food and to pay the first month's rent and deposit.
Community.
Our life has changed dramatically since we left the nursing home in February. I think that Carol has made significant advances being at home. They got her on the right track, got her started on the right road for recovery, and she's progressed very well.
Independence.
Being on your own and doing things on your own, noticing you can do it again, or that you always could. You should have never doubted yourself.
And yeah, I'm in my apartment, and I'm just so glad to be in here during a difficult time like this at the perfect time.
We know that thinking about moving can feel daunting, especially in these uncertain times. But if you believe that you or a loved one should live as independently as possible in the safest setting available, please contact your local Center for Independent Living. Their nursing home transition programs will do their very best to find a community-based home with all the support and services you need for a safe, secure, and dignified life.
It just felt so right, and I felt my freedom coming back.
Roads to Freedom Center for Independent Living of North Central Pennsylvania, www.cilncp.org, 800-984-7492.
So the video we just show, or the video you just saw, was a video that our Center for Independent Living decided to produce and sort of help educate our communities on, on transition. I know the analogy I said prior to showing the video was that transition services are offered on blue sky days. And so, we're talking here about a pandemic and disaster emergency relocation. And so for us at Roads to Freedom Center for Independent Living, as we, early on in the pandemic, we sort of sat back and started looking at some of the transition services that we were providing and the individuals that we had in congregate settings, and trying to work with other advocates and partners like some of Ebony and some of the presenters you'll hear later on in this webinar, to figure out how do we respond and provide emergency response services to the individuals we're providing transition services to that are right now locked into congregate settings like Ebony described. And so on this slide here, I have a flow chart that can be found on the ACL website of services offered through independent living centers. And you'll see circled and where the red arrow is moving from institutions. And then there's also resources here on the ILRU website, the ABCs of nursing home transition, which can provide some more detailed information on transition and sort of the ins and outs of it. Next slide. On this slide is a image of the ACL website again, and the link here for the peer transition programs and more resources about the initiating emergency relocation transition. This is the presentation we did back in March and has some more detail about the process we're going to share with you today. Let's see, we can go to the next slide, please. In those resources, adapting nursing home transition programs, really relocation is transition on steroids. Our team sort of, met back in early of 2020 and discussed how can we adapt our nursing home transition to incorporate emergency relocations using hotels, dormitories, motels, and with services and supports in place so that, individualized assistance was available, attendant care services, DME, transportation, all of the things that we would typically be using in a transition, but sort of expedited with the use of a hotel room as well. During the federally declared disasters, FEMA, as we're doing this, we understand that April of 2020, FEMA initiates a Category B funding approval for homeless first responders and healthcare workers. Shortly after, we worked with other, allies, the advocates, to discuss, what does FEMA Category B funds look like? What do they cover? And sort of understand FEMA a little bit better. And later in this presentation, Marcy's going to share more information about that. But this is sort of a timeline of the work and the advocacy related to one emergency relocation that we provided in Lycoming County. And during this process, and there's a sort of more extensive listing of all of the correspondence and the timeline that that we had, but this is sort of a condensed version to show you that. So as soon as we learn about FEMA approving Category B funds for non-congregate sheltering, we start thinking, how can we use that or those funding sources to help relocate people in congregate settings. May 13, advocates asked officials to give residents and institutions the option to move to a safer environment. Next slide, please. So with the FEMA Category B funds, we understand that there's reimbursement for life-saving emergency protective measures. And as we follow up in June, by this time, advocates are convening with federal, state, and local officials to understand what Category B looks like, how to request reimbursement through it. And you'll see here on the slide, infections are now being tabulated, 124,249 infections, COVID infections in nursing facilities or long-term care facilities rather, and 36,591 deaths. And during this discussion in late June, FEMA is eager and willing to explore the possibility of reimbursing a Center for Independent Living on relocation services. Our state Department of Health is interested in looking to tweak policy to see if there's a way to use FEMA Category B funds. FEMA says funding only goes to facilities, and we'll talk a little bit more about that. What the reference is during a federal declared disaster, FEMA reimburses state, local, tribal, territorial governments, and certain eligible private nonprofits. Unfortunately, SILs are not considered private nonprofits, and we'll learn that later. You can go to the next slide, please. So inconsistent government policy positions sort of delay the process a little bit further as we're trying to figure out with FEMA what sort of Category B funds, if relocation is eligible and how to draw down those funds. We're advised to go back to our county. FEMA's position in November of 2020 at a disability summit is sort of reinforcing that FEMA wants flexibility on how communities respond and sort of suggests we go back to our local county emergency management agencies. Also in November of 2020, Governor Wolf says Category B funds are only specified for those three categories we mentioned earlier: homelessness, first responders, and healthcare workers. The state, FEMA says independent living centers are explicitly excluded as an advocacy group per FEMA rules, and sheltering does not fit into the current allowable non-congregate sheltering actions as defined by FEMA in October of 2020. Later, they ask if ILCs operate a facility and ask as a FEMA question. So, I mean, we can see that there's still this sort of, miscommunication or lack of knowledge on transition services provided by Centers for Independent Living and how that relates to emergency relocation, and whether or not we're a private nonprofit with a facility or what we later learn is a community-based organization. So also on this slide, Lycoming County Emergency Management Agency provides information to advocates, which sort of contradicts the earlier advice of FEMA and PEMA, and says, county officials have no reimbursement authority, and so you have to go back to state PEMA and FEMA. And so we sort of go in this cyclical circle for a little bit. Next slide, please. Thankfully, in December, early December of 2020, with the help of the advocates from the Partnership for Inclusive Disaster Strategies and the World Institute on Disabilities, there's finally an update and a FEMA addendum that sort of goes over Category B funds. As we've been working and asking FEMA for more clarification, I think, we'll see in this addendum here in the link, and all of this is included in the resources on your webinar where you entered the session. Pages 7 and 8 call on counties to establish relationships with community-based organizations. And they specifically, name SIL's community-based organizations. So, and then, advise on attendant care services and transportation and what services are actually covered under those Category B funds. Next slide, please. So inconsistent policies continue to hinder sort of the work, as we had to spend all this time advocating and understanding the process. In January 20, in the beginning of January, or late January 2021, Secretary of Pennsylvania Department of Human Services, Teresa Miller, says as an NHT provider, SILCP, or this was a letter, sorry, from me to Secretary Miller. As an NHT provider, SIL has successfully transitioned 54 people in 2020 from nursing homes during the COVID pandemic. Unfortunately, during this time, we've had 6 people die from COVID before the transitions could be completed. And here's where I'm urging our state to advocate for emergency relocations and help us get more clarification on how we can actually request reimbursement. This entire time, as I've explained, we're putting expenses forth, not knowing if we can, request reimbursement through FEMA. Our state practices in managed care, and so Secretary Miller had been interested, or at least in the process of discussing whether our managed care organizations would also participate in this, and to what extent we could request reimbursement through. During this time, infections, 617,447 infections in long-term care facilities, and 122,180 deaths in long-term care facilities due to COVID. So next slide, please. And just as a little, we've been providing transition services for decades, and I started in 2005 and had never experienced deaths on our transition, of participants waiting to get out of the facility like we had, of course, during this time. So as the numbers continue to increase, we continue to request for further clarification. March 4th of 2021, we hear from the Administration for Community Living that they heard of our emergency relocation work and is interested and finds this is an innovative approach that they'd like to have further discussions on. Next slide. So here's a slide that sort of outlines communication between February 2021 to the end of August of 2021 with all the infections and deaths included. So on February 2nd, we submit a draft memorandum of understanding to our county emergency management agency. Actually, that was on January 13th, and this was our understanding of what needed to take place in order for us to request the reimbursement for the expenses provided to the individual that we relocated. On February 2nd, the county emergency management responds and says it's been sent to solicitor for review. Infections are at 635,202. Death rate is now 635, 2002. Oh, sorry, that's the same. I don't think that's right. Maybe that's a typo, so sorry. We'll fix that. March 19th, 2021, we checked in on the status of our MOU and find out that the County Emergency Management Agency sends us a link for what we would use if we were a private nonprofit, which we established long ago that we weren't. So further continuation may bring us to May 4th, 2021, and the county spoke with FEMA and in order to move forward needs us to revise our invoices so that they're addressed to the county rather than to FEMA. We do that, and then August 9th, we get an update from FEMA that still is not currently eligible, an eligible applicant because we didn't complete a form that the county needed to complete. On August 31st, we finally get the confirmation that our county submitted the paperwork needed for the next step in the process, and we are officially an applicant. So from what started in April of 2020, we are now at August 31st of 2021 and finally have an application in. Next slide, please. August 19th, we're going back a little bit, but just to point out that between the August 9th and August 31st timeframe, this correspondence took place with the director of the Office of Equal Rights and the Partnership for Inclusive Disaster Strategies, where there was further discussion, and it was realized that our county and FEMA, there must have been some miscommunication between the two. We had not heard from the county as to whether we were approved or not. And so in following up, we understood that there was further discussions between Lycoming County and FEMA and the county. So FEMA's rendition was that the county's willing and has reached out to the SIL to address our application with them. They said, FEMA says the request to somehow submit an invoice directly from FEMA is not an option and that, it's not needed, they can go to the county. Well, one thing I left out earlier is as many SILs cover many counties, we cover 36 counties for transition. If you can imagine this process with each county, that's unrealistic. Like I said, this was for one relocation in one county. Next slide, please. So on the screen is two pictures of the US with infectious. One shows the infections of COVID-19 cases in nursing facilities from July 5th to September of 2021. On the right-hand side is the infections of the deaths in the nursing facilities for the same time frame. And as you can, this slide is showing a gradual from light pink to dark pink as the US fills up with COVID infections and COVID deaths during that time. And so we just wanted to show this, that during the process of trying to find out how to go about paying for relocation services, we talk about the transition service being a recently added service that didn't come tied with funding availability or extra funding. Having to sort of upfront the costs for emergency relocation. If we could shorten that process and certainly be a private nonprofit that drew down from FEMA, it would make it much more realistic than going to each county and developing an MOU and then going through the process of advocating for and receiving reimbursement services through FEMA, through the county. So that's the long story or the condensed story from our experience with emergency relocation. There's more information and resources to give you sort of examples of the MOU we used and some of the resources that I add in my slides. And with that, I will turn it over to Marcy Roth from the World Institute on Disabilities to share more about FEMA Category B.
Thank you very much, Misty and Ebony and Alyssa and everyone who has been working together. My name is Marcy Roth. I'm the Executive Director of the World Institute on Disability. I'm an older white woman with COVID gray curly hair, red glasses, a black top, and I'm sitting in a room with a fireplace behind me and some red roses. I'm going to give a very brief couple of slides about FEMA's Public Assistance Category B Emergency Protective Measures process. And I want to say that FEMA's reimbursement is now proven to be a solution for independent living centers. We still don't have a solution for providing those funding resources up front, but thanks to the work that Misty and her Center for Independent Living did, we now know that FEMA can reimburse centers for Category B eligible work. And I'll talk a little bit more about that in a moment. Next slide, please. So just to kind of get us sort of all on the same page, there is a federal disaster declaration process, and it begins with either a disaster or a threat of disaster. State resources are considered to be overwhelmed. The governor of that state requests federal assistance, and the president issues a declaration. Next slide, please. When that presidential declaration is declared, it could be one of two kinds of declarations. It could be either a major disaster declaration or an emergency declaration. And in either case, public assistance can be provided if the state requests it. Now, to be clear, public assistance is not like what we think of in human services. Public assistance is infrastructure support in emergencies. Next slide, please. So when we're talking about emergency declarations and public assistance, we're talking about emergency protective measures. We're not talking about individual assistance or hazard mitigation. We're talking specifically about public assistance and most particularly Category B emergency protective measures. Next slide, please. And FEMA provides these resources, reimbursement resources, to state, local, territorial, and tribal governments and certain nonprofit organizations. Next slide, please. And they have a 166-page guide that describes how all of this works. So you can, you have the link here and it'll be on the website. Next slide, please. And those emergency protective measures are to eliminate or lessen the immediate threats to lives, public health, or safety. And there's a long list of things that are included: transporting and pre-positioning equipment, supplies and commodities, medical care and transport, evacuation and sheltering, use or lease of generators, dissemination of information, and keeping in mind that every federal dollar spent by the federal government or given to the state or given to a grantee must comply with the Rehabilitation Act, physical access, program access, effective communication access. So I have argued for a very long time that independent living centers should be able to be reimbursed for transportation that might be provided during a disaster if you're assisting people to evacuate. It might include the opportunity to provide information in alternate formats before, during, and after the disaster. It might include providing assistance in a shelter or in a disaster recovery center, or many other types of emergency protective measures. Next slide, please. And as Misty was talking about, there are a number of facilities that are considered to be nonprofits that are eligible. Disturbingly, FEMA identifies 3 types of places that actually are considered nonprofit organizations eligible for FEMA assistance. And those 3 are daycare for individuals with disabilities or access and functional needs. And then they specifically identify Alzheimer's disease, autism, and muscular dystrophy. The second category are residential services for individuals with disabilities. And the third category are sheltered workshops that create products using the skills of individuals with disabilities. So I'm sure you will join me in my disgust over the very narrow thinking that went into the development of these policies. Next slide, please. So there is quite a bit of information about non-congregate sheltering that became a particular focus during COVID. Next slide, please. And FEMA approved 100% cost reimbursement to the states to relocate people experiencing homelessness from homeless shelters to non-congregate settings like hotels and motels. And this period is from January of 2020 through November 30th of 2021. And actually, it probably exceeds that because they've now just extended the public health emergency. Next slide, please. And this, of course, includes infectious diseases, and FEMA works with the Centers for Disease Control in providing assistance, and that assistance includes rescue, evacuation, movement of persons, movement of supplies, care, shelter, and other essential needs of affected human populations. So needless to say, the work that independent living centers do and other disability-led organizations is work that should be reimbursed. Next slide, please. And again, there's a long list of FEMA also provides assistance not only for sheltering, but in transitioning people when there's no longer an immediate threat to life or public health and safety. Next slide, please. And there are a long list of those essential community services. I'm going to move quickly here. Next slide, please. And there are very important policies that have enabled the housing of people in non-congregate settings. Next slide, please. And FEMA has made that funding available. If it weren't for Misty and her center, independent living centers would not have become eligible. Well, they were eligible all along. We would never have cracked that code. Next slide, please. And while this is the end of my slides, I'm now going to ask that we move to the next slide, which is a video. And this video is of the Washington Monument and a recent art display, art installation with the 700, which is now 727,000 people who've lost their lives to COVID. We know that of those 727,000 people who've died here in the US from COVID, the vast majority of them are people with disabilities. Next slide, please. And so as we look at those flags, which are covering the area in front of the Washington Monument, and next slide, please. And a close-up of some of those flags, thanks to our friend Marjorie Rifkin. A flag for each state has been planted, and those flags outline the number of deaths in institutions of our people due to COVID. Thank you very much. And I am now going to turn to Herman Parodi to take us through the next slides.
Gracias, Marcy. My name is Herman Parodi. I'm the co-executive director of the Partnership for Inclusive Disaster Strategies. I'll follow Misty by saying I'm a middle-aged brown Puerto Rican man using a wheelchair. I'm wearing a black scarf and a purple long sleeve shirt. As you've heard today, there are many issues, but there's a path forward. What we need to do, and to make this streamlined, is having FEMA acknowledge Centers for Independent Living and other community-based organizations as eligible private nonprofits under the FEMA Public Assistance Program and Policy Guidelines. And they need to engage with the disability community leaders at the federal, state, and county local level. HHS and ACL could also fully fund all the activities covered under the 5th core service, as you well know, and create a new 6th core service around emergency management. And congressionally, there is the Rio Emergency Access for Aging and Disability Inclusion for Disasters Act, HR 4938, S2658, which will create technical assistance and research centers for inclusive emergency management for people with disabilities across the country. And the Disaster Relief Medicaid Act, which will make Medicaid portable in disasters. That's HR 4937, S2646. And to learn more, visit us at reaadi.com. Lastly, please join in 2 days in the April conference on Thursday, October 21st at 12 p.m. Eastern time, where we will take this conversation further in our Inclusive Disaster Resilience During the Pandemic panel at the April conference. Thank you for having us.
Thank you so much to all of our presenters. We're going to jump right to the Q&A. We have just a few minutes left and we should be able to we've got 2 questions. First, coming to us from an anonymous attendee. This question is for Misty. Why is your SIL a nonprofit? Wait, why is your SIL not a private nonprofit?
This is Misty. So just to be clear, as a Center for Independent Living, we are a 501c3 nonprofit organization. However, as recognized by FEMA, private nonprofits are, like Marcy explained, daycares and institutions rather than nonprofits as we classify a nonprofit. Does that answer the question?
I think it does.
Okay, moving on to the next question from Ori Houston. I would like to know how I can apply to do the World Institute Disability Operationalizing Inclusion and Leading Global Disability Rights program for FEMA.
Well, thank you very much for that question. This is Marcy Roth. And feel free to reach out to me. Our contact information was on the previous slide, and I know it will be on the website, and I will be happy to connect you with the folks that are doing work that you might be interested in getting involved in. And that would include the Partnership for Inclusive Disaster Strategies and April. Of course, you're already involved with April. There are a number of us who are working together on both on a daily basis and through a shared initiative to relocate people out of institutional settings in disasters and to shut the front door and tear down the walls.
Thanks, Marcy. This is Alyssa, and we are coming up on about 5 minutes left. I don't see any more questions in the Q&A box. However, I do want to remind everybody that there will be resources on the April conference website for everything you have heard here, seen here, the slideshows, the videos, everything will be available to you. And I also want to remind you to please fill out your evaluations. You should be prompted as soon as the session ends. Please do that. That helps us improve if we need to. It gives great feedback for the presenters, and it's a very important part of making our conference a success every year. So I appreciate all of you joining us today. And if you have any further questions in the next couple minutes, please go ahead and pop them in the Q&A. We've got about 3 minutes left, or we can give you 3 minutes back of your day.
I think Ari wanted to say something, but I don't know. Ari, do you have your hand up to speak, or did you just want to connect with Marcy later? Okay. Well, thank you all again. And like Alyssa said, we dropped the evaluation in the chat as well. And we hope to see you at this evening's events of a social hangout. It's definitely not a lounge